Good morning, Mr. Rubin. How are you doing today?
Not well, doctor.
Not well. What happened? What brings you here?
I've been having difficulty. Having trouble to open and close my mouth for the past few days.
Really? So which side is having problem?
When I open this side, especially
side?
hurts more.
Hurts more.
Yeah.
So is it like you're able to not open completely?
Yes. I can open partially, where when I try to open fully,
It hurts.
It hurts.
Is this the first time you're having this problem, or have you had this before?
I've had several times, but none of it is as worse as this
okay.
time.
So can you tell me roughly since how many days are you having this problem?
First, the pain started around Monday, 4 days ago. But then now already the 4th day that I having this pain, and it's getting worse and worse each day. So that is why I came to meet you today.
Okay. So if I can ask you, how did it start? Do you remember any specific, like you either had a fall on that side, or you ate something very hard and you got hurt on that side? Do you recollect something like that?
I didn't feel any. Nothing such happened like that. It's just suddenly one day it just started.
Suddenly one day it started. So on a scale of 0 to 10, how bad is your pain?
First it started was around 3 to 4. I still could manage, but now it's already become close to 7 to 8.
Oh, right. Okay, so that means
So
getting worse.
Yeah, it's very painful.
Okay.
I couldn't eat properly.
Have you noticed any swelling on that side?
I've been holding. It's not swelling. It's just when I open.
It's just painful when you're opening. Right. So if I may ask you, that do you feel any noises when you open your mouth? Do you hear?
Yes, I do feel like it's like creak sounds.
Some kind of noise on that side. So then can you point out to the area exactly where you're having pain?
Here mostly.
Okay.
And I open it.
It's hurting. So now let me just go back to you and ask you about yourself. What do you do?
I'm just a student, final year student studying, preparing for my exams. So I'm about to sit for my final exam.
Okay, so do you feel that the exams are getting worried about the exams?
A bit.
A bit, yes, of course, understandable. So, are you sleeping well?
Some days I might not sleep well because I study until too late night. So I might have to sleep at 1, 2, or maybe sometimes 3 o'clock.
Okay.
And then wake up and go to classes.
Right, I understand. So I just want to ask you some more questions regarding this. Have you noticed that you clench your teeth or you grind them at night?
I usually sleep with my brothers, and they notice that when I'm sleeping, I have a habit of grinding
So during the daytime also, do you see that you're consciously clenching your teeth? Let's say you're stressed about something.
So far, no one actually said anything. They mostly it's my siblings and my parents only say when I sleep. Yeah,
you tend to clench your nose.
tend to clench.
Okay. So is the pain worst when you wake up in the morning?
This pain?
Yeah.
Yes. Because
and then during the day, is the pain still there? Is it?
Yeah, the pain was still there continuously.
Continuous pain,
Yeah.
and that means you're always having some kind of dull pain.
Yeah.
So do you categorize it as a dull pain or like really sharp pain, or
It's just feeling numb like that.
Numb kind of dull kind of pain. That means it's constantly troubling you.
Yeah.
Okay, so I will need to do some examination. Okay, to look at you further, and then after we've done the examination, we will decide whether we will need to take radiographs.
Okay.
All right, to check what is happening. So. what we feel that is actually there is a very small problem. It's nothing to be really worried about, right? So we will try to palpate your muscles on that side as well as the joint. The muscle seems sore, okay, but there is some noises from the joint, right? So, but it's all related to stress on that side. So it could be because you have been consciously or subconsciously clenching your teeth, because of which the joint and the muscles are fatigued. So we call this as a temporomandibular joint disorder, but it is not something that you need to get very worked up about. It will heal after you have taken precautions and some medication that I will prescribe for you. But there are some important instructions which I want you to take note of. First of all, I want you to avoid getting worried or concerned about how you are of that side. So don't constantly keep chewing only on one side, balanced on both sides, right? So avoid always noticing that your teeth are contacting each other or you're having a problem there. So we want you to take your mind off it. Don't keep checking and testing your jaw like when you're driving or when you're working or when you're listening to a lecture or a class. Don't stress on the jaw. Don't cup your hands and put a lot of stress on that jaw, right? So we want you to always don't keep on testing that area, like keeping your tongue at the back of the teeth and checking. We want you to modify your diet just for a couple of days. For this week, try to avoid foods which you might have to chew a lot, like avoid eating very hard substances, for example nuts on that side especially. Avoid eating foods which are very chewy and sticky, right? Don't chew gum till the pain reduces, right? And don't try to open excessively, right? So for example, avoid foods like a whole apple. Instead, cut it into pieces and eat it, which would not allow you to open completely. Then like I said, avoiding certain postures like leaning or cupping the chin with your arms while sitting down on the table or dining during when dining. And don't sleep on your stomach, right, so that the pressure is on that jaw, that side. In case you're going for dental treatment, avoid opening for too long. Maybe you can inform your dentist that you've had problems that side, and so they will avoid long appointments. Also, support your jaw when you're yawning, so that you don't subconsciously open very wide. We will recommend you to do massage that side occasionally at home, right? Also, we want you to apply cold compress and alternatively hot fomentation on that side. That means we want you to apply cold compress with the help of ice or an ice bag for about 10 to 20 minutes. Give a break and then use hot fomentation with the help of a towel that is dipped into warm water. Squeeze out the water and apply it on that entire jaw, the muzzle on that side and the area, right? So I will be putting you on some medication and you will see that there is improvement. I want to reassure you that you're not having any problem. It will subside and your x-ray also looks okay, right? So I will see you in a week's time, right, to check on you, how you are doing. Should there be any need, you can always call me for that, right? Thank you.
Thank you, doctor.